Advice on giving IV sedation. Giving anesthesia. When undergoing surgery, some patients require anesthesia from the anesthesiology team to facilitate surgical treatment. There are several ways to give anesthesia depending on type of surgery, underlying disease, patient's choice. 9 steps to prepare yourself before receiving anesthesia. 1. Abstain from all kinds of food and drink for 6 to 8 hours. 2. Report your history of congenital disease and use of regular medications, such as antiplatelet drugs, diabetes medications, blood pressure medications, and others, as well as vitamins, dietary supplements, and herbal medicines to your doctors. 3. Report allergies to medicine, food, or all kinds of substances, and also your previous surgeries and other health problems. 4. Refrain from smoking at least 2 weeks before surgery to reduce flame and cough. 5. Remove nail polish and have fingernails cut short to enable measurement of oxygen at fingertips and observe changes due to lack of oxygen. 6. In case of receiving current types of surgery, which does not require an overnight stay in the hospital, you must have relatives who can assist in contacting the staff, act as a caregiver on the way home, and take care of you for at least 24 hours. 7. If you are pregnant or suspect that you are pregnant, you must inform the anesthesiology team because some medicines can pass through the placenta and may cause detrimental effects on the baby. If surgeries are urgent, it should be done after giving birth. 8. Remove removable dentures, contact lenses, and all kinds of jewelry. If you have loose teeth, the anesthetist should be informed. 9. In case of illness related to the respiratory system, such as fever, cough, sore throat, sputum, or runny nose, the anesthesiologist must be informed in detail. Patients must recover for at least 2 weeks before anesthesia can be administered with minimal risk. Giving sedation by IV. Patients will be cared for during surgery or other procedures. The doctor or anesthesiologist may also consider prescribing pain relievers to reduce anxiety in cases where the patient may be awake or asleep to facilitate surgery or procedures. Risks: deep sleep until unconscious, pressed breathing, pressed cardiac function. In very few cases, patients may face more serious complications that can be dangerous, such as sucking food particles into the lungs, causing pneumonia, severe allergic reaction to anesthetic, and death. When it's time to give IV sedation by IV, vital signs examination procedure, measure blood pressure, perform an electrocardiogram, check the oxygen concentration in the blood. Anesthesia procedure. Your doctor or anesthesiologist may consider giving pain relievers by IV drip to reduce anxiety, to help you feel sleepy, or to help you fall asleep. You may receive oxygen as well. Patients will receive symptomatic care throughout surgery or procedure from the anesthesiology team. The surgical team will also supervise closely. Guidelines for behavior after receiving anesthesia. Stay in the recovery room 30 minutes up to 2 hours. Return to recuperate in the room or go home. In the case of returning home, your relatives have to pick you up. Do not drive yourself. You should have someone to take care of you for the first 24 hours. After anesthesia, you will receive oxygen. You should take deep breaths in and out to allow the lungs to fully expand. It can be done immediately after awakening. Early post-operative ambulation. You should change your sleeping position regularly. Turn your body on your side at least every 2 hours and sit up and exercise as soon as you feel better. If your doctor allows you to eat, you should eat a little at first, then observe whether there are symptoms of abdominal discomfort or not. The next day, you can start eating normally. especially when returning to recuperate at home. You need to nourish your body because food makes you healthy and wounds will heal faster. Take all medications according to your doctor's treatment plan. If there are abnormal symptoms, you can call to inquire or come back to see doctor before your appointment date. Once you have received complete information and you are ready, please sign your consent. In the letter of the consent, for the use of anesthesia, complete before receiving the anesthesia service. We love you. May you all be safe, good health. Anesthesiology team, St. Mary's Hospital. Thank you.